Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aizat Akmal bin Muhammad. My metric number is 10 DKM 20F 1092. Today I would like to talk about my assignment title, that is asthma. Okay, what is asthma? Asthma is a long-term disease of the lungs. It could cause your airway to get inflamed and narrow, and it makes it hard to breathe. Severe asthma can cause trouble talking or being active. You might hear your doctor call it a chronic respiratory disease. Some people refer to asthma as bronchial asthma. Asthma is a serious disease that affects about 25 million Americans and causes nearly 2 million emergency room visits every year. With treatment, you can live well. Without it, you might have to go to the ER often or stay at hospital, which can affect your daily life. Symptoms of asthma. There are three major signs of asthma. First, airway blockage. When you breathe as usual, the bands of muscles around your airway are relaxed and air moves freely. But when you have asthma, the muscle tighten it harder to air to pass through. Second, inflammation. Asthma causes red swollen bronchial tube in your lungs. This inflammation can damage your lungs. Treating this is key to managing asthma in the long run. And lastly, airway irritability. People with asthma have sensitivity airway that tend to overreact and narrow when they come into contact with even slight trigger. This problem may cause symptoms such as coughing, especially at night or in the morning, wheezing, a whistling sound when you breathe, shortness of breath, tightness, pain or pressure in your chest, trouble sleeping because of breathing problem. Okay, when you want to see the doctor, get medical help right away if you have serious symptoms including fast breathing, pale or blue face, lips or fingernail. The skin around your ribs pull inward when you breathe in, trouble breathing, walking or talking. Symptoms that don't get better after you take medication. What is an asthma attack? An asthma attack is when your symptoms suddenly get worse, your airway tightens, swell or fill with mucus. Not every person with asthma has the same symptom with an asthma attack. You may have different ones at different times. They may be less obvious, like having less energy. They may also range from mild to severe between one attack and the next. How is asthma classified? Doctor rank how bad asthma is by its symptoms. First, mild intermittent asthma. Mild symptoms less than twice a week. Nighttime symptoms less than twice a month. Few asthma attacks. Second, mild persistent asthma. Symptoms 3 to 6 times a week. Nighttime symptoms 3 to 4 times a month. Asthma attack might affect activities. Third, moderate persistent asthma. Symptom 3 to 6 times a week. Nighttime symptom 3 to 4 times a month. Asthma attack might affect activities. Number 4, severe persistent asthma. Ongoing system both day and night. You have to limit your activities. Your asthma may be getting worse. Your asthma may be getting worse if you have symptoms more often and they interfere more with your daily life. You have a hard time breathing. You can measure this. With a device called a peak flow meter. you need to use a quick relief inhaler more often. Okay, what are the type of asthma? There are several types. First, adult onset asthma. Asthma can start at any age, but it's more common in people younger than 40. Status asthmaticus. This long-lasting asthma attack don't go away when you use bronchodilator. There are a medical emergency that need treatment right away. Asthma is a asthma insurance symptom that can vary from episode to episode in the same child. Watch for problems like coughing, often, especially during play at night or while laughing. This may be the only symptom. Less energy or pausing to catch their breath in or out. Seesaw motion in their chest because if trouble breathing, shortness of breath, tight neck and chest muscle, weakness of fatigues. Exercise-induced bronchoconstriction. You might hear this called exercise-induced asthma. It happens during physical activity, when you have to breathe in air that drier than your body and your airway narrow. It can affect people who don't have asthma too. You will notice some symptoms within a few minutes after you start the exercise, and they might last 10 to 15 minutes after you stop. Second, allergic asthma. Things that trigger allergies like dust, pollen and pets, dander can also cause asthma attack. Thirdly, non-allergic asthma. This type flare in extreme weather. It could be the heat of summer or the cold winter. It could also show up when you're stressed or have a cold. Occupational asthma. This usually affect people who work around chemical fumes, dust or other irritating things in the air. Next, nocturnal asthma. Your asthma symptoms get worse at night. Aspirin-induced asthma. You have asthma symptoms when you take aspirin along with a runny nose, sneezing, sinus pressure and cough. Cough variant asthma, unlike with other types, the only symptom of this kind of asthma is a long-term cough. Asthma causes and trigger. When you have asthma, your airway react to things in the world around you. Doctors call this asthma trigger. They might cause symptoms or make them worse. Common asthma triggers include infection like sinusitis, colds and the flu. Allergens such as pollen, mold, pet dander and dust mites. Tobacco smoke, air pollution, exercise, cold air or changes in weather such as temperature or humidity. Asthma risk factor. Things that might make you more likely to have asthma include things in the world around you before you were born or while you were growing up. Whether your parents have asthma, especially your mother, your genes, your race. Asthma is more common in people of African American or Puerto Rican descent. Your sex, boy, are more likely to have asthma than girl. In teens adult, it's more common in females. Asthma diagnosis. If you think you have asthma, see your doctor. They refer you to an asthma specialist, also known as pulmonologist. The doctor will start with a physical exam and ask about your symptoms and medical history. You'll have tests to see how well your lungs work, including spirometry. This simple breathing test measures how much air you blow out and how fast. Methacholine challenge. Adults are more likely to have this test than children. You might get it if your symptoms and spirometry tests don't clearly show asthma. During this test, you inhale a chemical called methacholine before and after spirometry to see if it makes your airway narrow. If results fall at least 20%, you have asthma. Your doctor will give you medicine at the end of the test to reverse the effect of the methacholine. Chest X-ray. It isn't an asthma test, but your doctor can use it to make sure nothing else is causing your symptom. An X-ray is an image of the inside of your body, made with low doses of radiation. Spartan eosinophil pills. These tests look for high level of white blood cell in the mix of saliva and mucus that comes out when you cough. Asthma treatment. Many asthma treatment can ease your symptom. Your doctor will work with you to make an asthma action plan that will outline your treatment and medication. They might include inhaled corticosteroid. This medication treat asthma is the long term. That means you'll take them every day to keep your asthma under control. They prevent swelling inside your airway, and they may help your body make less mucus. Leukotriene modifiers, another long-term asthma treatment. This medication block leukotrienes things in your body like trigger an asthma attack. You take them as a pill once a day. Long-acting beta agonists. This medication relax the muscle band that surround your airway. You might hear them called bronchodilator. You'll take medication with an inhaler when you have no symptom. They include formoterol, salmeterol. Combination inhaler. This device gives you an inhaled corticosteroid and a long-acting beta agonist together to ease your asthma. Common ones include fluticasone and salmeterol. And lastly, anticholinergic. This bronchodilator prevent the muscle band around your airway from tightening. Asthma complication. When it's not under control, asthma can cause problems with your daily life, such as fatigue, lack of exercise, hospital or ER visits, missing work, time away from school, or trouble focusing on schoolwork. Mental health issues such as stress, anxiety, and depression. Asthma can also lead to serious medical conditions, including pneumonia and other complications from common infection like the flu, early delivery, for the loss of the pregnancy. Permanently narrow bronchial tube in your lungs collapse, respiratory failure. Asthma attack prevention. Your action plan will include different ways to keep your asthma under control and prevent this might include. So that is all my can I talk about what I can talk about asthma. So thank you. Assalamualaikum.